So, as we all know, there are multiple causes of chronic cough. So, you'll always think of if someone is presenting to you with chronic cough, you'll think of TB, pneumonia, ILD. But you should also think of GERD, gastroesophageal reflux disease. You should also think of post nasal drip. You should also think of AC inhibitors. And lastly, the most important one, which we'll discuss with great pulmonologist Dr. Rajendra Nanavare sir. So the last important cause of chronic cough is asthma. We all know it has got triad, breathlessness, wheeze, and chronic cough. So we'll ask sir his view and opinion about bronchial asthma and how to deal with it. Yes.
Thank you. Thank you for inviting. So, the cough, there are four conditions in asthma. One is a chronic cough with sputum, the expectorant, chest tightness, breathlessness. Now, how to differentiate the cough? It's very important. And there is any changes in the environment, any changes in the this thing, like a climate changes, then there is a allergen, which allergen causes bronchoconstriction. Now the bronchoconstriction, it causes the main pathology of bronchial asthma is the inflammation of the bronchi.
Mm-hmm.
Now, what will happen? It is how to diagnose clinically. First, very important part.
Mm-hmm.
Clinically, the patient will be young age, mostly in a child, but it can occur at any age also. But the patient will tell, I am getting cough in the night, most common in the night or early morning. This type of cough goes into the favor of asthma. When you take X-ray,
Mm-hmm.
there it's a normal X-ray. There won't be anything in asthma.
Mm-hmm.
Some other comorbid condition will be to exclude that we take X-ray.
Mm-hmm.
But here the very important for the diagnosis of asthma is pulmonary function test.
Mm-hmm.
Now the pulmonary function tells us that it is an obstructive disease.
Mm-hmm.
Now the once we come to know obstructive disease, whether there is a reversibility. If force vital capacity and force uh, FEV1 upon FVC is less than 70%,
Mm-hmm.
and after giving a bronchodilator it increases,
Mm-hmm.
which should be more than 200 ml
Mm-hmm.
or 12%,
Mm-hmm.
then we say there is a reversibility, and the reversibility is very common in asthma.
Mm-hmm.
So we can differentiate between COPD and asthma. There are obstructive diseases as COPD, asthma, bronchiectasis, and bronchiolitis.
Okay.
But to differentiate all this condition, this is the diagnostic test,
Mm-hmm.
reversibility test. Now you want to know about the treatment part. The treatment part is you should give ICS to every patient. ICS means inhaled corticosteroid
Okay.
with bronchodilator.
Mm-hmm.
Now the bronchodilator can be LAMA or LABA, but LABA is a very active than LAMA.
Mm-hmm.
So LABA plus ICS is a treatment of choice.
Okay.
Then when you are doing the treatment, you
Mhm.
feel that there is some infection, bacterial,
Mm-hmm.
then go for a bacterial infection. But
Mm-hmm.
most common,
Mm-hmm.
the 70% of the patient
Mm-hmm.
are having a viral infection.
Okay.
So for a viral infection, it takes 7 days to respond. So
Mm-hmm.
4 or 5 days, within 4 or 5 days,
Mm-hmm.
patient will be all right. The
Mhm.
best treatment for asthma is inhaler.
Okay.
You should
Mm-hmm.
not go for a when there is a exacerbation, when
Mm-hmm.
there is an acute attack.
Mm-hmm.
That time only you go for a oral steroid,
Mm-hmm.
but don't go for the oral steroid unless and until it required. But ICS is very safe and very effective.
Great.
One thing you have to do, you rinse your mouth after doing
Mm-hmm.
inhaler.
Mm-hmm. change of voice
change.
can,
Huh.
and fungal infection can be a
Huh,
common.
huh. But still, ICS is one of the safest side to
Mm-hmm.
give the treatment
Mm-hmm.
to any person who is having a reversible type of obstruction of the
Okay.
disease.
Okay, okay, sir. So thank you so much. Like in Ayurveda, we differentiate Vata Pradhan and Kapha Pradhan tamakshas. You have beautifully said what asthma is all about and how to treat it. So thank you so much for coming to my page, sir. And it's a great pleasure.
Thank you, thank you. And I also feel very nice to attend with you because you are having a good knowledge of your subject,
Uh,
particularly Ayurveda, at the same time other also.
okay.
Very nice.
Thank
Nice
you.
to meet you.
Thank you so much, sir. Yes.